progress. Alrighty, so we're ready to start. Hello and welcome, everybody. Today we're going to have a follow-up conversation with AltaMed and LTHC titled "A Community's Perspective on Mental Health: Listening Session Findings." And we're looking forward to sharing some key findings that we've had from our listening sessions back in March of this year with the Southeast Los Angeles community. My name is Gaston LaSalle. I'm a policy analyst with the government affairs team here at AltaMed. And over the next hour, you'll hear from our partners, Rosa Flores, who's Director of Programs at the Latino Coalition for a Healthy California, also known as LCHC, and also our mental health and behavioral health expert, Francis Chinchilla of AltaMed. So Rosa Flores is going to be providing us with an overview of current statewide policies affecting mental health services, delivery, and care, particularly impacting vulnerable communities. And then Francis of AltaMed will answer our question, what is the community saying regarding access to mental health services here in LA County? Before we get started, we'll do a few housekeeping announcements. The webinar is being streamed and recorded. I'll go ahead and do that right now. And we'll be making it available far and wide through LCHC and AltaMed social media channels. We're also currently live streaming via Facebook and YouTube. At any time during this webinar, you can submit a question to our speakers using the Q&A button at the bottom of your screen. You'll see a toolbar, and you'll get a small window where you can write in and submit your question. When you do submit your question, please indicate which speaker the question is addressed to, and your name and organization. We will be holding all the questions until the end of the speaker presentations, where we have set aside some specific time for Q&A. And with that, we can go ahead and get started. I would like to turn the microphone over to Rosa Flores, Director of Programs at the Latino Coalition for a Healthy California. The floor is yours, Rosa.
Thank you, Gaston, and good afternoon, everyone. Thanks to all who are joining, possibly on their lunchtime or their break time. We're so grateful to have you here to let us into your office or maybe your home office. As Gaston mentioned, my name is Rosa Flores. My pronouns are she, her, ella, and I am the Director of Programs here at LCHC, the Latino Coalition for a Healthy California. A little bit about myself and a little bit about LCHC. I am based in Sacramento, but I am a SoCal native, so always repping San Diego. And my role here at LCHC is I am responsible for the community engagement strategy and portfolio for the organization. We're a statewide policy advocacy organization. And so we really seek to engage Latino communities and in all different ways of advocacy. I'd like to mention that prior to LCHC, I actually ran the migrant health programs for an FQHC, that's a federally qualified health center in San Diego and in Orange County. So FQHCs and community clinics hold a special place in my heart, and I certainly recognize the importance of community clinics and FQHCs for our community's physical, mental, and civic health. So I'm super proud to be partnering with AltaMed and the wonderful team of government affairs. And then a little bit about LCHC. As I mentioned, we're a statewide policy advocacy organization. We're based in Sacramento, but we have team members all across the state, from the border region in San Diego all the way up to SAC, and soon hopefully expanding to the Bay Area and everywhere in between. And our mission is simple. It's really to advance and protect Latinx health through policy and advocacy and build healthier communities across the state. So really what that boils down to is that we believe that everyone, regardless of the language that they speak, their immigration status, their zip code, their income source, has the right to live long and healthy lives. And we know there are systems in place that sometimes don't allow that. So, we certainly believe that health is not just absence of illness, but actually the ability to thrive, and health is a fundamental human right. So that's a little bit about LCHC, and I will go forward and share. Oh, can we pull up slides? I'm not seeing them on my side. Let me know if y'all see. Oh, there we go. Perfect. Awesome. And there we go. So as Gaston mentioned, my role today is to provide a couple of statewide policy updates that are going to be impacting our community's mental health. And I've basically broken it down to 3 different buckets. The first is talking a little bit about the modernization of the Mental Health Services Act, the CARE Act, which is a little bit newer to our work, but certainly very significant. And then also funneling into what we're here to focus on today is the community program planning process, specifically for LA County. So the Mental Health Services Act, or the MHSA, is probably the policy that folks on this call may be most familiar with. It was established in 2004 through Prop 63, which basically imposed a tax on California's wealthy to support public mental health services. A fun fact is that one of the key leaders for this policy included then Assembly Member Daryl Steinberg, who happens to be Sacramento's mayor now, and of course other mental health, behavioral health advocates. And what the policy has done in its throughout its lifetime is it's really facilitated the delivery of much needed services to some of our state's most vulnerable populations. And specifically, it created funding to fill gaps in the adult and older adult, and then youth and children's systems of care when it came to mental health. A really key component of the MHSA is that there also was the establishment of an oversight and accountability commission, right? So that's really important when we're creating policy. Part of the advocacy is the actual legislation. The other part is making sure that there's correct implementation and oversight. And so that really gave way to the MHSOAC. There's a lot of alphabet soup here, so I'm going to try to break those down, which is the Mental Health Services Oversight Accountability Commission. And their role is really to support the equitable delivery of services and development of programs. And they fund a lot of different initiatives across different counties and regions of the state to ensure that services are the most culturally competent they can be with the public resources available. What is happening now with the modernization is that, MHSA is nearly 20 years old. And so there is a need for an update that considers new data. We've been through a census, we've been through a pandemic, we're still dealing with the pandemic. And so we really need to consider different community needs and the needs of specific populations. Even within the Latinx community, there are subpopulations, and now more and more, we're starting to see the importance and the significance, for example, of disaggregating data to even pay closer attention to those needs. So what we can expect over the next few years is really a big push by the administration for a bond measure to appear on the 2024 ballot, which the bond would hope to raise several $millions to make sure that we update the MHSA and that there is continued funding for public mental health services. We know that our country, and not just the state of California, our country is facing a mental health crisis. A lot of the data that our partners at AltaMed will present will demonstrate that. We are also very much in a housing crisis. And so both these issues of mental health and housing are not new. And so these solutions that are going to be presented over the next few years are not the entire solution. It's a piece of the puzzle aimed to support, California's most vulnerable population. So stay tuned for more from LCHC and from other advocates at the statewide level on those updates. Next, I'll go into talking about the CARE Act, which is another policy that is impacting our communities as of late, also known as SB 1338. Some folks might know it as CARE Court because of its tangential relationship with the court systems of different counties. What CARE Act stands for is basically the Community Assistance Recovery and Empowerment Act. And what the administration intended to do is establish a framework to support those with severe mental health illness, like schizophrenia and other severe psychosis. And so what the policy calls for, in a nutshell, is for people who are living with severe mental health illness to be connected with court-ordered care plan, CARE, right, to highlight Community Assistance Recovery and Empowerment Plan, for up to a year, and then possibly there could be an extension after that year. The interesting thing about this policy is that there's some guidance at the state level, but really every county behavioral health, mental health department is responsible for establishing its own implementation plan. And we're going to start to see the rollout of several counties over the next few weeks, and then the rest of the counties will follow. And it's going to be really interesting. A lot of us, LCHC included, and other health equity advocates are concerned about the implications of this particular policy on communities of color because we know historically communities of color, low-income communities, limited English-speaking communities, immigrant communities have been have tensions with the court, and that's not necessarily the first place people go to when they're looking for social service navigation support. So there's an estimation that about 7,000 to 12,000 people will be affected across the state. Again, our concerns lie around the how it'll impact communities of color who, again, are continuously over criminalized. And really what we want to avoid is more interactions with the legal system. And we'd rather focus on funding social workers, more clinicians, et cetera. So a lot of us statewide partners are keeping up in conversations with the administration, and we are engaging in statewide conversations, but we thought it was important for us to highlight that, as we know there are concerns that we've heard from community. Let me really quickly, okay, I just want to make sure I'm good on time. And the last piece I will talk about today is what we're here for in general, which is the community program planning process, CPP. I said there was a lot of alphabet soup. Basically what the CPP is the process that counties have to engage in, again, behavioral health, mental health departments, to include community members, especially those who are directly impacted, those who are consuming county behavioral health services, in the decision-making process about what programs get funded, how much they get funded, and for how long. So any county that is receiving MHSA funds, so remember that's the statewide policy, it funnels down to the different counties, they have to develop a plan that's called a 3-year program. And with that plan, they have to include where the dollars are going for the different buckets. And so they have to identify how they intend to spend that money and how it's supporting diverse communities. So again, the point of the CPP is to include directly impacted folks and folks that are consuming public mental health, behavioral health services. And that includes folks like older adults, seniors, young people, family members of those that are living with severe mental health illness. And so throughout the whole process, folks are supposed to be engaging. Through our research, which Francis will present, we learned that not a lot of folks are actually up to date or informed as to why or what the CPP is, I'm sorry. And I think that the responsibility lies with the county departments. I know they're doing the best that they can with what they have, but really, partnering with CBOs like AltaMed is crucial to making sure that this process works the way it was intended to. So this is why we're here. We engaged in a community listening session that took place last year, a few months ago, and we learned several key pieces of data by folks that are directly, again, impacted by county behavioral health, mental health, and or who have a family member who has interacted with the mental health, behavioral health system. With the information that was collected, we will continue our advocacy efforts at different levels, right? So folks often ask, well, why are we here? Like, we talk to so many people, we share our experiences, what comes of it ultimately? And what will come of it ultimately is basically advocacy at 3 different levels. So there's the hyper-local level, right? Where we're working closely with AltaMed to ensure that we're filling the gaps where there are gaps, and really outreaching to those who are in close proximity, who are in the patient pool. And then there's also regional advocacy that we're engaging in through the behavioral health, mental health department of LA County. And then lastly, but just as importantly, we're engaging in statewide policy advocacy through channels LCHC is engaged in with the California legislature and the different state agencies and departments. So I know that was a lot of information. I'm happy to answer questions now or after related to any of what I've mentioned so far. I'll hand it over back to Gaston.
Thank you so much, Rosa, for including that really important contextual information, right? This does not happen in a vacuum. The really goal and purpose of our listening session is to inform policy, right? And get direct feedback from the communities that are most impacted. And with that, we'll get straight to the lessons learned and the findings that we were able to collect during the sessions that we held back in March. Um, as a reminder to participants, if you do have a question, you can submit it at any time using the Q&A button on the toolbar at the bottom of your screen. We will hold all the questions until the end of our speakers' presentations. Next, we're going to hand the mic over to Francis Chinchilla, clinical therapist and behavioral health expert here at AltaMed. Welcome, Francis. The microphone is yours.
Thank you, Gaston. Hello, everyone. Again, my name is Francis Chinchilla. I'm a licensed clinical social worker, a mental health provider out of the East Los Angeles area, and a clinical manager for the behavioral health department. I've been with AltaMed for 8 years now, and just want to thank the group, the team, for letting me participate in this listening session. And we learned a lot from the participants. We had a really great turnout, so much so that I don't think we could accommodate everyone that wanted to participate. So we had some participants who, wanted to participate, but unfortunately, hopefully it's conversations we can continue to have and invite them back in the future. But the team that we did have was super engaged and very forthcoming, and I would love to be able to go over some of the feedback that we got. If we can have the first slide. Somebody can pull up I don't have access to the slides. Great. Let's see. Apologies, not too familiar with the tech, but let's see if I can move the slides. There we go. Okay, so we had 27 residents show up from the Southeast Los Angeles area who shared their experience as well as family members' experiences in accessing county mental health services in the city of Los Angeles. And some of the feedback that we got was that, for one, they were really excited about being part of these conversations. They really stressed how important community members' participation is when it comes to this topic, because they are the consumers and they do have a voice and they have a say in the way that services are being promoted and delivered. So one of the main things was that they really wanted more engagement opportunities, even spaces like the ones that we offered during the listening session, to come and have these conversations about their opinions about a lack of access, lack of information. They even voiced wishing that these types of opportunities were offered on a regular basis, a monthly basis, where they can come together and just be of support to each other and have their voices heard by members of the community who can also influence service delivery on a county level. One of the main issues that came up was the lack of awareness that exists about mental health services within the Latino community, and the lack of awareness of resources that are available for our community members. I think one of the patients said that, one of the participants said that they don't know where to even begin to find out information on how to navigate services, how to get engaged into treatment, that they often find a lot of barriers when it comes to connecting to services. And we'll also go into a little bit more depth about the barriers that they identified. One topic that was addressed a bit extensively was the engagement of law enforcement within the community. So just to start off with, I think historically, law enforcement in these types of situations, mental health situations, tends to have not so positive feedback from our community members, as a lot of those interactions tend to have been negative. A lot of people hesitate to even call 911 when there is a mental health crisis because of fear of how they're going to engage the person who is in crisis. I think we've had a lot of exposure on the news and media about situations that go awry because law enforcement doesn't know how to handle these types of citizens, in terms of like, just they don't have the right training to address mental health crises. So I think oftentimes what happens is that when a family member is having a mental health crisis, participants will not call 911 and will not access services just because they fear the engagement that comes along with law enforcement as well. And another issue in terms of accessing services is the taboo that exists within our community. A lot of the participants mentioned a lot of fear related to just judgment and shame around mental health conditions. Unfortunately, it's gotten a whole lot better. As a provider, I do predominantly the patients that I see are Latino and have a lot of different ideas about accessing care, but there still exists a lot of stigma. And so people will tend to go to primary care physicians when struggling with mental health, but they won't present it as a mental health struggle. It tends to be manifested as psychosomatic symptoms, headaches, stomach aches. And so they'll go there to their physical or make an appointment to see the provider and start to share some of their concerns about their physical health. But as a provider digs deeper, then it's evident that there are mental health concerns. And if they're lucky, their provider will refer them to mental health services. But even with that encouragement or education from the provider about mental health services, there might still be hesitation about engaging in care because of the stigma that exists. I think oftentimes there's a lot of shame for our participants to admit that they have to speak to someone regarding their mental health concerns. I think culturally, we tend to be very tight-knit in families, that we have this idea that we don't share our problems with strangers. We keep it within the family. And so we're less likely to seek support from a professional. Another avenue that people tend to seek when struggling would be faith-based organizations. So these are things that people will do before coming to a mental health provider because of the stigma that exists around participating in mental health services. And we did have some participants share about their experience in relation to sharing with family and friends that they are participating in mental health services, and that they've had negative experiences and negative feedback from loved ones about seeking care. So we can understand why they are hesitant. So the next point that came up was the difficulty with Los Angeles County offices. Participants expressed a lot of concern regarding the difficulty accessing mental health services in LA County offices. I mean, just from even calling the number, the long wait times, being given referrals to organizations that aren't taking new patients or aren't taking patients that will give the person the type of treatment that they're looking for, right? So if they're looking for a specialized care for something like an eating disorder, a lot of county operated facilities won't specialize in these types of things. So what they're getting is a lot of referrals that aren't actually going to be able to service them the way that they need. And another barrier to care is getting services in the language of preference. Unfortunately, we are, I guess we can say, sort of understaffed with Latino providers who are bilingual and can provide services in the language of preference for community members. People also want to see providers that understand and reflect their culture as well. And as we know, mental health services are hugely impacted right now. And unfortunately, the providers are not available. And even getting an appointment, patients are now reporting, and participants reported, that the wait time is up to 3-6 months to be able to be seen. So participants might want to engage in services, but then they're being told to wait 3 months for an initial appointment. By that time, they probably have become disengaged, have lost interest, and will not be following through. So there's just numerous obstacles to getting proper care. Another point is that the service delivery options are not always easily accessible. I think a lot of people have a preference for in-person services. At this time, a lot of stuff is being done telehealth. And one of the issues is being tech savvy. A lot of our older participants are not very familiar with platforms where telehealth is being done. And so they're having a lot of issues with connectivity. They even shared wishing that there were some type of like educational program that can better inform them of how to use these platforms so they can access these services. So service preference was an issue that came up as well. Sorry. And those were the main issues that came up during our conversation. Again, all the participants were very open, very vulnerable about their experiences, and it really sounds like they don't feel like they have a say in the way that services are being delivered to them, and they're eager to be part of the conversation. They want to be at the table. And I think it's a wonderful opportunity to continue to explore these opportunities to engage the community in service delivery.
Thank you, Francis. I think one of the most, and for some context, I had the privilege of co-facilitating the sessions along with Francis. And one of the things that stayed with me was just seeing how much the community members, the excitement that they had at having a platform really to be able to share these frustrations in a way that was affirming, right? This was a community that had not had the opportunity to make their voice heard in a way that was empowering, and that's something that really stayed with me. And I know with Francis as well, because at the end of the session, it was energizing, I think, to be able to provide that platform. There was, crying. I think people really had an opportunity to advance and
Yeah, definitely. I think it was very, I think you said it, empowering for them to be able to have a voice and have a say, and to feel like what they had to say was of importance and that it can inform service delivery. And I don't know if it's really that Latinos don't want to seek care, but I think that, this is some of the sentiment that came from the participants as well, is that they just need more information, right? Like they just need to know about services, how to access them. They want community engagement around decreasing stigma around mental health. We were lucky to have some promotoras in the group with us as well. And I think that the community members really look to them for just insight and guidance. They're a well of knowledge for the community. So I think more opportunities for community members to engage in that type of facet would be a wonderful, in terms of just really spreading the word about the county's efforts to provide care was one of the things that stuck out. And I had a lot of participants come up to me after the conversation wanting to consult about mental health and wanting to get more information about resources. So I think that if the resources were available and readily available to them, and they knew where to access this information, they would be accessing care.
Thank you, Francis. So we'll go ahead and move on to the Q&A section. We have several questions for our panelists. So we'll begin with the first question for Rosa. So you mentioned 3 different pieces of legislation. How do we communicate to communities in need of services that these resources that are provided or in the legislation will be available to them?
Thank you for that question. So the onus is supposed to lie on the county behavioral health department. So for LA, that would be the of mental health. I know that sometimes resource and knowledge on how to get the information to actually reach communities is limited. And so I think another great option is to be connected to your CBO. So community clinics are often, folks that bridge the gap between, community members and larger healthcare systems. So I know from experience that AltaMed has quite a robust outreach team. And the promotoras are also a great vehicle, and as Francis mentioned, a wealth of information. Additionally, if you want to stay connected with LCHC, we also work with a network of promotoras who try to make these updates on policy and the programs that result from these policy changes more digestible through programming called Pasa la Voz, depending on which county that you're in. So I'll be sure to share that information after this meeting, after this webinar.
Thank you, Rosa. We have a question for Francis. There is still a lot of stigma regarding mental health. Many community members don't know where to begin, like you mentioned. What is the first step you recommend for someone new to mental health care who has not interacted with the mental health system before?
So let me get a clarity on the question. The first step for a new consumer of mental health services?
Right.
In terms of accessing care?
So I think it's more geared towards what is that first conversation with a primary care provider like around?
Okay. Yeah, and so also knowing that it doesn't have to be a conversation with a primary care provider, right? Like it could be a direct conversation with a mental health provider that they can also link themselves to mental health care through their insurance, right? Or LA Care, Care First, any type of Medi-Cal, you do have access to scheduling your own appointment without a need for a referral. But in terms of like initiating the conversation with a mental health provider, with a physician, there should be screeners being done, right? So your mental health should be screened at least on a yearly basis. And that opens up the conversation between you and your provider. And your provider hopefully will recommend behavioral health services. And feel free to ask questions. Ask as many questions as you would like. And when you do set up that initial appointment, know that the mental health provider should be giving you an understanding of what mental health services are, what the sessions are going to look like. There should be an expectation. And also know that if it's not a good fit, it's not a good fit. That you are free to request a different mental health provider. Because at the end of the day, the therapeutic relationship is a relationship, and you should feel a sense of connection. There should be rapport between you and your provider.
Thank you, Francis. We have another question for you from Cynthia Romo. How has COVID-19 changed the need for mental health resources, especially in medically underserved communities?
Yeah, so as a provider myself, we saw a huge spike in requests for behavioral health services, and it's definitely a trend nationwide. As we all know, the pandemic really had an impact on our mental health for a variety of reasons. And it had a drastic effect, statistically a drastic effect in our community, in the Latino community, for, again, several reasons, socioeconomical. It's very complicated, right? So we did see that spike. And in terms of accessing, unfortunately, it's impacted the mental health system. So appointments are not readily available. Wait times are a month, if we're lucky, to 3-4 months out, and that's the reality, unfortunately. I think one of the things that came out of the pandemic that has played in our favor is telehealth. So mental health services are more easily accessible to patients, and it doesn't have to be virtual. It could be through the phone. Interestingly enough, a lot of patients do have the preference for phone sessions, even over in-person sessions. So that is a plus, in the sense that patients don't have to leave work early. They don't have to commute to us. They don't have to go out of their way to seek childcare. Some of the participants did mention their preference for this type of service delivery. So that's what I can say about the impact of the pandemic on mental health care.
Thank you. We have a question for both panelists, and we can begin with Rosa, maybe. In LA County with LACDMH, the MHSA information and process they have are rarely available in Spanish. Sometimes we get information late and or inaccurate. This year we had MHSA leadership make the decision not to provide information in Spanish for a stakeholder who wanted to participate in the MHSA process. Are there any requirements in the MHSA or state to ensure that our Latino stakeholders are not excluded further in MHSA?
Thank you for that question. And I'm sorry to hear that that was the case. That's unfortunate. Those are the types of situations that we are in examples that we're looking for, so that we can present it in our advocacy with the different leadership. I would say, it's important to be connected. I'm not sure who exactly or what committee you spoke with, but I would say that the committee that first comes to mind would be the Latino Underserved Committee, which has monthly meetings. And, LA County is not the only county that we're working on in terms of language access. I think we're trying to do that in every county, California. But I would voice your concern there and work with advocate organizations. For example, if you're a direct service organization, maybe you don't have the bandwidth or the capacity to engage in those conversations as consistently as we need to, use us as your vehicle to elevate those concerns. Whoever asked that question, I would be really curious to connect with them, because we actually have meetings set up with the department coming up fairly soon, and would love to bring that up as a point.
Thank you, Rosa. Francis, anything you'd like to add?
I don't know. I think Rosa covered it. Yeah.
Perfect. So another question from Carolina Valle. She says, I'm curious if any of the community members talked about 988 and their experience with it.
I can answer that one. No, none of them talked about it. And I think my experiences just with my patients is that they don't know about it. That's all I can really say about that. They don't know about the number. So again, just the lack of dissemination of information in a language that's understandable for a population.
I will share that I think 988 was newer back then, and
yeah, it's fresh. Mm-hmm.
It's newer. Yeah, it was fresh information. And like any new service or campaign around a public service, that we need to give it time, and we need to work with trusted messengers, right? And something that Francis mentioned earlier, and that was a resounding theme throughout the listening session, was the role that promotoras, community health workers, play in making sure that the right information gets to the people who need it the most, right? And so I think if anyone was familiar with 988, it was the promotoras who were in the room. And I know the Department of Mental Health is trying to integrate promotoras more and more in their work, particularly in the mental health sector. And so if anyone from the Department of Mental Health is tuning in, we implore you to continue to invest in those strategies, because those are really the people that will literally carry home the resources.
Thank you, Rosa. And I'll direct the next question to you. What can we expect for future advocacy on this issue? What is left to do? How can we get involved?
There is so much left to do, which, and as I mentioned, it's tiered, right? So there's statewide advocacy, there's regional advocacy, and there's hyperlocal advocacy. So it all depends on what's in your interest and what's within your capacity. We engage in traditional advocacy, which looks like legislative visits with different decision makers and different state agencies. But it also means, joining local committees or working with your local CBO to engage in things like listening sessions, because believe it or not, the research or the listening sessions that we're engaging in really helps inform our policy priorities. And so whatever is within your means, we're happy to plug you in. I know both the AltaMed government affairs team and the LCHC programs team is always looking to plug folks into opportunities. So I wish I could see who's asking those questions, because I'll be the lady that folks won't forget, and there will be a way to get involved.
Thank you for that comment. Really important to the role that advocacy plays. And I'll kind of bring back up the feedback that we got from the participants and how they were asking, how can we continue to be involved? Is there another session coming up? So there's definitely that need in that community. And also, these are opportunities to also engage community members in advocacy, organizing, etc. There's as you mentioned, lots of different forms to become involved.
Yeah.
But with that, yes,
Oh,
go
sorry,
ahead.
can I add? If anyone wants to leave their contact information, we're happy to connect you. If you're an individual, we're happy to connect you with opportunities to be engaged. If you're an organization, something else I'd like to put on your radar is also a coalition or collaborative that's run by our partners who are helping provide resources for this work. The California Pan-Ethnic Health Network, CPEHN, runs a collaborative called the Behavioral Health Equity Collaborative. And I'm sure if you go on their website, the CPEHN website, that's California Pan-Ethnic Health Network again. You can sign up for updates, or I'm happy to connect you directly to that coordinator, because they also do a lot of really great work across the state and different priority regions.
So I don't see any additional questions, but Rosa, any last thoughts on your end?
No, just thank you so much for partnering with LCHC. Please continue to see us as a resource for community and for organizations. We're always interested in finding different ways to collaborate. And I'm always willing to sit one-on-one with someone who has anything to share on the topic of mental health, because it's certainly a priority for us.
Thank you, Rosa. Francis, any last thoughts?
Other than I look forward to having more of these conversations, and I look forward to engaging community members in more of this work. I want to see where it goes. And I know the participants were also eager to find out the outcome, right, of their discussions. So I guess we'll see.
Thank you so much. So with that, I will mention that we'll share Rosa's contact information in a follow-up email along with our speaker slides, and then additional resources that any participant can feel free to distribute. Again, thank you, Rosa. Thank you, Francis, for being part of this webinar and being part of this process with the listening sessions for us. And thank you to all the participants that decided to join and engage with us and share your questions. All your feedback and input is very valuable as we continue on this process. And with that, I wish all of you a really great day. We'll continue leading on this work we're very excited to see what comes out of it. Have a great afternoon, everyone.